All right, good morning, everybody. Thank you so much for being on with us. I'm Carly Strauss on the Third Plateau team. So excited to have you all here for this final installment in our Third Plateau Organizational Crisis Response Series. Today, we're going to be talking about leadership and equity in uncertain times. So glad to see so many people on the line. Just so you know, you are all muted and we can't see you, but we really appreciate you being here. We are recording this session and we'll be sharing that recording and the slides very soon online. And just wanted to go over a few housekeeping items. We've got about an hour together here. We're going to start out with a presentation and there will be plenty of time for Q&A at the end. If you've got any questions, you can throw them in the Q&A function or the chat box. You can also chat me, Carly Strauss, if you're having any technical difficulties. But again, thank you all so much for being here. And Jonathan, take it away. Jonathan, you're on mute.
Yes, I am, and now I'm off mute. You figured by the fourth session we'd learn how to do this. Anyway, I'm really excited to be here with everybody. Thanks for making it to part 4 here. Before I get any further, I want to introduce my co-facilitator here, Aparna from Moving Beyond. It's been an amazing partner in crime with us here at Third Plateau, and we absolutely love the work that Aparna and her team do. Aparna, do you want to give just a quick intro of who you are and Moving Beyond?
Sure. Hi, everybody. My name is Aparna Ray, and I'm the founder and principal at Moving Beyond. Similar to Third Plateau, we call ourselves an impact practice, and what that really means for us is helping our clients operationalize diversity, equity, and inclusion through strategy and evaluation. In the social sector, we care really deeply that the impact organizations have is sustainable and long-lasting, and so yeah, we're really excited to be here today and talk about how leaders can navigate this moment of crisis with an equity.
Fantastic. So you'll all get to hear quite a bit more from Aparna a little bit later, but I'm just thrilled to have her on the call today and getting to do this. As you'll see, she and her team are phenomenally brilliant and bring a much needed lens to this space and conversation. So excited to have them here with us. So before I get going, just want to remind everybody there is a ton of information on the website. So if you've got questions, you want recordings of the past webinars, you want slide decks, you want the templates, you want frameworks, whatever else we put together, please, please, please go take a look at the website. There's also a lot of other resources there that we think can be helpful for organizations navigating this very bizarre time. So today, in terms of what we're going to be covering, there's 2 pieces that have been sort of key elements of every phase along the way that we have talked about, leadership and equity. And we wanted a chance to actually have an entire session that's just going to talk about those 2 pieces, both in how they play a role in the phases we've talked about so far, but also as we start to turn towards recovery phase, how critical both of those pieces are. And really getting to round out the rest of that disaster cycle management with these 2 pieces around leadership and equity. I want to touch again, we've shared this slide a number of times. I want to touch on a couple of pieces here about things that are really different during and after a large-scale crisis that we think are really relevant to leadership and diversity, equity, and inclusion. The first one is that our brains are operating differently. Decision-making and behavior are erratic. So on the leadership side, this plays to all of our worst tendencies if we let it. You're panicking, you're trying to move quickly, you're overwhelmed with what's happening. Your leadership tendencies are likely going to pull you into behaviors and habits that are not you at your best. And I'm going to talk about that in a little bit, but want to call that out, how critical it is to really check yourself in these times of crisis, to make sure that we are being the best leader we possibly can be. Similarly, is that you're going to operate with limited information, and one of those pieces is going to be your own implicit or explicit biases that you bring into the space. So, for example, I own the fact, and especially for this session, that I'm Jewish, white, and male, which means I bring a certain perspective and viewpoint into my work and into the world that's largely shaped by the privilege that I have experienced in my life. Which means when I'm moving quickly and trying to understand how I can best be of service, I'm doing so with that mindset and that mentality. And you can see very quickly why that becomes problematic when you start to realize that this crisis is impacting people of color and marginalized communities more than anyone else. And so how do we actually start to check our own biases and own that our brains are operating differently and playing to some of the worst habits and worst tendencies we have, unless we check it and intentionally push ourselves in a different direction. The second one is that everyone is feeling these shocks, right? Nobody is immune to experiencing the difficulty that today brings, right? These are just bizarre, unprecedented times for anybody currently alive going through this. And just acknowledging that, like, as leaders, we have to check in with ourselves and make sure that we're equipped to actually be leaders, and that we can be really empathetic with the communities we serve, and recognize that everyone's feeling this, but not everybody's feeling it the same. And we have to actually approach each of those subgroups and segments of our population, acknowledging that they have a unique lived experience that we need to be able to account for and respond to and help support. I could talk about all of these, but I'm going to actually jump to the last one here, which is what was previously the unexpected has become the expected. None of us prepared for COVID-19, right? But now we're in this situation, which means even though we maybe couldn't build up our leadership resiliency or our organizational resiliency beforehand, we're now in that place where now we know that's exactly what's needed, and we can plan for it, and we can actually start to build towards it. Similarly, around the equity side is that while we were unprepared and did not expect these impacts or to even be impacting various communities this way, data is now coming out that Aparna is going to talk about a little bit later, that's showing us exactly what's actually happening in our communities. Meaning we now actually can plan and be far more intentional about how we come as leaders and how we bring an equity lens into this work. Okay, if you're joining us at this part, I'm hoping you've seen this chart before. If not, here you go. But this is Disaster Cycle Management 101. We've talked a lot about this, that one of the reasons that we are all so overwhelmed and feeling stressed right now is because we got thrown into this in the response phase after the disaster happened. And we were never able to actually build the mitigation and preparedness efforts to get us ready for it and to minimize the impact it's actually having. And so this is us really trying to respond in the moment, but playing catch up. So the first two sessions really focused on how do you think about a rapid needs assessment and preparing yourself for a response phase. The third session we had in this webinar series focused on mitigation and preparedness, acknowledging there are other parts of this disaster that are going to continue unfolding. Unemployment rates are going to continue to go up. What happens with education? Our education system is going to continue to get more complicated as more and more students are doing distance learning or removed from teachers and learning environments. Things around healthcare, what's happening? Those are going to continue to become more and more complicated. But now we can actually start to prepare for and plan for them because we understand how the cycle is evolving. And the mitigation and preparedness efforts give us a chance to brace ourselves for what might be coming, and then do both minimize the likelihood that it happens, or at least minimize the impact that happens if it does occur. All of these phases are really reliant on both leadership and equity. And I'm going to talk about how this plays a key role in all of these phases, and then we're going to spend the rest of the time talking about recovery, which is really where a lot of this can live. So in the response phase, we'll start there since that was the beginning of our conversation here as part of this series. In the response phase, leadership, it's got about leading with empathy and curiosity to execute those internal and external rapid needs assessments, right? We have to push ourselves to realize what we are experiencing in the crisis is not exactly what everybody else is experiencing. We just have to acknowledge everybody is being impacted. And so leading with an internal and external rapid needs assessment will allow us to understand, okay, here's how different groups are being impacted here. Here's how this looks across the different demographics. And now here's what I can do as a result of it. And on the equity side, thinking really expansively and inclusively about who you're talking to and how you think about your population. On the preparedness and mitigation side, leadership has got to create a safe space to explore these really scary and difficult what-if scenarios, right? What happens if a team member gets really sick and needs to get hospitalized? What happens if somebody passes? What happens if, and you can fill in the blank and really thinking through all of these very scary scenarios, but as leadership, it's critical for us to think about them and talk about them openly so that we're prepared for it if it actually were to happen. On the equity side, it's recognizing that these different crisis events are going to impact different segments differently, and leaning into that instead of trying to oversimplify it. And finally, it's thinking about who we can collaborate with and who we can coordinate with, really leading in with equity and diversity and inclusion to figure out who are those partners that I should be talking to help make sure that my entire population is getting what they need. This recovery phase is when we think about how to build a better future. And the two most important ingredients to thinking through how to build a better future is leaning into your leadership and leaning into equity. This is a framework that we use when we talk about strong leadership. It's a very simplified model, and it's saying we want to lead above the line. When you're leading above the line, you're open, you're creative, you're focused on learning, and you're curious. It's about how do I grow? How do I get better? So if you think about some of the sessions that we've led so far about wanting to think like an entrepreneur and get out there and learn as you go, it's not about being right. It's about how do I constantly get this better? How do I think expansively, both about who I'm interacting with, how I'm interacting with them, and what's actually possible. Below the line is when we're closed, we're committed to being right on something. We're less open-minded about what things can happen. And we have this scarcity mindset of thinking, the sky is falling, I gotta operate quick, I gotta go do X, Y, and Z to like save something, as opposed to really thinking back and going, really what's possible. So this gets to the, we mentioned earlier of having, in a crisis, we're often pushed to our worst tendencies as leaders, right? We start to think of we become reactive. We think about scarcity. We think about control, right? This is exactly how this needs to go. As opposed to when we actually make some of our best decisions as leaders. And if you think about the best decisions you've made personally and in your organizations, I can guarantee you that those have come from a place above this line. How are you thinking expansively and creatively and really about what might be possible if, or what could we do if? We want to push ourselves above this line as much as possible. Throughout a disaster crisis and the disaster cycle, wanting to think about actually checking in with yourself as a leader of where am I at the moment? Am I operating below this line? In which case I'm likely limiting the options in front of me. I'm probably not creating the safe space I need. I'm probably not taking care of myself or those around me. Or am I above the line? Am I leading with a mindset of abundance and possibility? Am I trying to stay optimistic and thinking about what actually is possible and how can we make this be? If we can check in with ourselves on that mindset, look, we are all going to be drawn and pulled below this line at times. All of us do. But the important thing here is being able to check in on ourselves and go, okay, where actually am I in this moment? And how can I be more above the line than I currently am? We're going to start to shift into the recovery phase, which is really an amazing, amazing opportunity for us to start to explore what's really possible, right? Our goal in the recovery phase is not to return to a status quo that existed pre-crisis. That world doesn't exist anymore, right? The world that we all lived in before COVID-19 does not exist anymore. What do we want this new reality to actually look like and be and feel like for people? What do we really want that to be? And the second piece of this is then, what do we need to do to make that reality come to life? As terrifying as a crisis like this is, it is so, the silver lining is so powerful of, it gives us a chance to rebuild. We can start to challenge some of those underlying structures and systems and inequalities that forced us into what the old status quo was. But now as we're rebuilding, we can say, well, let's actually challenge some of those underlying assumptions. Does it have to look that same way? If you were going to build this anew, would you actually design it in exactly the same way? Our operations and our organizations are so disrupted over the course of this last month and the next couple of months that it gives us almost not a blank slate, but pretty darn close to saying, okay, here's what this can look like coming out of this. Here's what this new normal can be for us. And if we're able to lead with strong leadership and staying above the line, and leading with equity, it opens up the door for us creating a vibrant, beautiful, thriving reality that maybe actually was impossible for us to create before the crisis. So I'm going to turn this over to Aparna to talk about how equity really plays a role as we think through that recovery phase. And then we'll circle back in for some questions and answers at the end. Aparna?
Awesome. Thank you so much, Jonathan. I think, I want to piggyback on what you were saying about an opportunity to not return to status quo. This is an opportunity where we can build something that's better and more equitable. And so I want to start my portion of the webinar really talking about what diversity, equity, and inclusion is, so that as I'm talking and using these words, you know exactly what I mean. So diversity really means just having a range of people with different racial, socioeconomic, cultural backgrounds. When we talk about diversity and moving beyond, we're talking about parts of someone's identity that either is a reason for them to have privilege or a reason for them to be vulnerable. So we're really looking at things like race, ethnicity, age, immigration status, their disability status as well, language they speak, and religion, because in the US context, those are the identities that create really different outcomes for us. Inclusion, we define it as a state or equality where everybody is recognized and respected, where we're asking people to come and not be forced to assimilate, but rather be completely valid for who they are and the different identities they bring. And then finally, we're going to talk a lot about equity. We already have been for the last 20 minutes. And it's a state of being just and fair within the context of historical and current power dynamics. And I want everybody that's joining us on the webinar today and anybody who's watching it later to really hold on to that bit about within the context of historical and current power dynamics, because that's going to be really important as we continue chatting. Let's go to the next slide. So what does DEI look like in uncertain times? And, for folks leading organizations, I'm going to offer 3 things for us to take forward. One is that we need to acknowledge that not everybody is equally affected by COVID. Jonathan and I, we have a fair bit of privilege as owners of consulting firms. We've been able to pivot pretty quickly to working from home and doing a lot of our client engagements from our homes. We also have the privilege of having homes that are large enough where we can be tucked away and have this quiet moment with everybody here on the call. And that's not everybody's reality. Not everybody has the opportunity to pivot their businesses. The second is that existing structural inequities are going to shape the racial inequities in this pandemic, and I'm going to talk about that a little bit later. And the second thing is that leaders have an opportunity to work in a way that doesn't cause additional harm to historically marginalized communities. So the reason to lead with an equity lens in this pandemic, and now more than ever before, is because we don't want to cause any more harm to communities that are already facing really deep disparities. Let's go to the next one. So when we talk about race specifically, I brought a couple of examples that I think are gonna help you see the context. We are finding across the United States that African Americans specifically are dying in much greater percentages from COVID-19. We know that in Illinois, it's 43%, even though the total African American population in Illinois is roughly 15%. In Chicago alone, we know upwards of 70%, same in Louisiana, and then parts of New York as well, that there's one specific racial group that is suffering as a result of this particular pandemic. And it's not because they're more predisposed to getting sick. It's because of a lot of historical conditions. 2 in particular, one, we know that urban Blacks are, living in tight quarters in cities. The second thing that we know is they're likely to be working in jobs where they don't have the luxury to be working from home. In hospitality, in retail, as drivers, and in other gig economy professions. We also know that school closures are disproportionately affecting Black, Latinx, Native, and other low-income groups, because kids no longer have access in a lot of geographies to food, to safety, to shelter, places that are really cold in the United States, and folks have trouble heating their homes. Schools are one of the few places that young people can be in where they have access to that. We also know that the long-term impacts of schools being closed for upwards of 6 months is that lower socioeconomic students are going to have a much harder time catching up when schools do reopen. The last thing that I'll talk about is, starting to become aware of immigrant labor and the fact that both documented and undocumented immigrant workers are not eligible for a range of federal benefits, including unemployment. So as you're thinking about your own institutions, policies and practices as you move into the recovery phase, and you're thinking about your beneficiaries and constituents, be mindful that there are some specific groups that are going to have a much harder time moving into recovery as a result of this pandemic. Okay. All right, so we've talked a little bit about this, why race matters specifically. It doesn't, it's not exclusively but explicitly about race. We want leaders, especially in social sector organizations, to be aware of a range of factors where they have blind spots, and race is one of them. We know that leaders in the social sectors are rarely from marginalized communities that they represent. And we know that as the organization's size and budget gets bigger, the leadership's primarily white. And that makes it really hard to navigate the community needs and challenges at this time. We also know that there are huge structural inequities in place, and we're starting to see that people from certain communities lack access to even the most basic healthcare. We know that African Americans in particular are being denied access to testing even when all symptoms are present. We know that the majority of communities of color work in jobs that deny them access to really basic benefits like paid family and medical leave and sick leave. And I think in particular, we're seeing that right now with corporations, and I have no doubts that we're going to start seeing that in the social sector as well. And more than ever before, like, if we don't take race into account, we actually risk spreading this infection. We're already in, so I live in Seattle, and we are in week 6 of sheltering in place. I know that my friends and colleagues in California have been at it a little bit longer than us. I think they're probably in their week 7. And we know that we're probably a week or 2 away from the rest of the country being in the same spot. If we're not thinking about communities that are disproportionately affected and how best to serve them, what we're going to see is just not being able to put a lid on this infection. And that's going to have implications for all of us. All right. So the last thing that I'll say on this topic, let's go to the next slide, is leaving anybody behind undermines all of us. I know there has been a lot of focus on healthcare workers and delivery drivers and grocery store workers, and as people that are responsible for making policies and deploying funds, if there's anything that I want you to take away from this conversation, is that leaving anyone behind undermines all of us. And this moment of being in a pandemic is an amplifier. I know there's a hashtag that's been trending. It's we're in it together. And every time I see it, I laugh because I'm in it together by being in my very comfortable home, with access to, you know, all of the creature comforts that I could want in this moment. And I know that that's not the reality of people that are, you know, 10 miles south of me in South King County, where there's like food shortages in grocery stores. So, all right, let's move on. So thinking about the recovery phase with an equity lens, I'm going to talk about three things. One is a privilege and vulnerability matrix. We're going to show you an example, and we'll also share a handout that's much more detailed. This is something that you can take back into your organization with a lens to who you are serving and who you'd like to be serving. So you can use it as a guideline to make your own matrix. We're also going to talk a little bit about shifting from chaos into complexity. And for any of like the nerdy people on this call, I'm referencing to Dave Snowden's Cynefin framework. And the last thing that we'll talk about, how we can start to invest in diversity as an antidote to really quickly move into the recovery phase. All right. So when we think about privilege and vulnerability, we really are looking at that historical context and also power dynamics in the United States. We know that some categories of people and certain identities are privileged, and the privilege is assigned to you. You're not working for that privilege. We also know that there are certain groups that are vulnerable, that they're going to face challenges, they're going to face outcomes as a result of that particular identity. And in this moment of COVID, some of these factors are going to get amplified. Already, we're seeing that older folks are at much greater risk. We know that your social class is in large part dictating your ability to access tests. We've already seen that if you come from wealth, or you work for instance, in Seattle, if you work for a Microsoft or an Amazon, it's a lot easier for you to have access to testing, which is going to determine your ability to get the care that you need in case you're sick. Let's go to the next slide. I want to give an example of how some of these things apply. I've picked out 4 categories in the handout. There are probably a dozen different categories to consider. And you'll notice that, we have a category, privilege status, that's, that's areas in your life where you have just a little bit of an easier time. And vulnerable is areas where you're either specifically targeted, or you lack privilege, and you're not getting access to certain resources because of having that category. One of the ways in which we have seen COVID play out is with a lot of South Asian communities facing both discrimination that's subtle, but also outright violence. We've seen a lot of vandalism in Chinatown, or international districts around urban areas. We've seen a lot of hate speech against really delicious Chinese food, and a lot of other Pan-Asian cuisine for no reason, in a way that we haven't seen necessarily hate or discrimination against pizzerias. The reality is that like a virus that originated on mainland China has now spread to lots of different parts of the world. The United States and New York specifically, and then Italy are like 2 of the largest centers of the outbreak outside the United States. But the kind of vitriol that we've seen against South Asians, that's not being experienced, by other racial groups. We've talked already a little bit about socioeconomic factors, and then I'll chat a little bit about family and social structures as well. This is an area where we're starting to see shifts in privilege, and vulnerability. So while we know that some of these categories are fairly static, this pandemic has opened the door and has like shifted a lot of categories. And so we know that folks that are part of larger family units have a better survival rate, you know, both physically but also emotionally and mentally. And folks that are isolated, that live in, you know, caregiving facilities, single people, for the first time, like those are folks that are just going to have a slightly rougher time braving the pandemic. Something to think about with this kind of a matrix is really creating one for your organization. You know, you are experts in your domain, and you have expertise in the folks, the communities that you work with. And in order to be super effective and really put your equity lens into motion, I invite everybody to create a matrix like this. It can have 4 categories, it could have 10 categories, but if you do it as a team and as an organization, it's gonna help you see where you have your blind spots. And so some folks will have blind spots when it comes to race, ethnicity, and socioeconomics, but we may also have blind spots when it comes to immigration status, if we're not an immigrant ourselves, or certainly a lot of us have blind spots when it comes to age and generational differences. So take this back, and it's something that I invite everybody to do after they get off this call. All right. I'm going to move on to talking a little bit about the Kuhneven framework, and specifically, you know, thinking about chaos and complexity. The framework basically states that we can be in one of 4 states. A simple state is where solutions are pretty linear. A simple state is, an example of that is saying, I'm hungry, and, you know, walking to your fridge, grabbing something to eat, and like problem solved. Now, somebody on this call listening in who has a little bit more nuance might say, well, what if my fridge is empty? And yeah, what if your fridge is empty? So, you know, then we move into this complicated the space where there are some best practice solutions and variables are clear. It might be a hard thing to do, like launching a rocket. But the number of variables are fixed, and most of the best practices exist and are documented. And so while it may take a little bit of time to figure it out, like you might have to get in your car, drive to the grocery store, pick things out, like while wearing a mask and, you know, like managing social distancing, but it's possible. Then there are domains where we don't know all of the variables, and we certainly can't control all the variables. Most of us, most of the time, live in the complex variable where we can't control all of the variables, but we can control some. This is a space where solutions are emergent, they're evolving, and it's a fun, interesting place to be in. This is like the space where a lot of innovation happens, and it's a space where a lot of us, you know, have tools to solve any number of problems. But currently, the domain that most of us are working in and through is in the chaotic realm. And the challenging thing about being in chaos is that it's all about containing the damage. It's about managing. It's about, you know, putting that gauze pad on your, you know, bleeding leg and just waiting for the bleeding to stop. Like you can't do stitches. You can't do anything. You're just there waiting for the chaos to stop. And equity is one way to move from chaos back into complexity or into a complicated realm. Can we go to the next slide, Jonathan? Before I talk more about that, I want to talk a little bit about like what chaos does, especially in moments like this. one thing chaos does is that it doesn't make all of the problems visible. So we know that there are problems, but we don't know the full extent of them. And also the timelines are shifting. So with COVID, all of us are noticing that we've gone from, 2-week shelter in place notices to 4 weeks to 6 weeks to, in many instances, indefinite, where we're seeing travel bans that are indefinite. And we don't know when things will come back to normal and what that new normal is going to look like. So developing solutions, like be it deploying grants or doing a program evaluation, like is a challenging time to do that. We also know that in chaos, leaders are making fast, decisive decisions, and that our organization structures really aren't set up for this. Most of us work in organizations where there is quite a bit of hierarchy, and in this moment, we're being asked to step outside of that. The third thing is that we're used to working in silos. We're working in different departments as consultants. We're either working in strategy or evaluation or program management. And by design, most of us are not working in organizations that are set up to have cross-vertical conversations. So makes the state really, really challenging. And we have to break the impasse. Otherwise, it's really hard to come into the recovery phase. Let's go to the next slide. So how do we shift back into complexity? I'm going to offer 4 things. I think depending on where you are in your organization, some is going to be really easy to implement and some is going to take a little bit of hard work, sweat. The first one, I think, for everybody is just acknowledge that the plane that we're operating is constantly shifting. And starting to be okay with the fact that the ground underneath is shifting and we don't actually have a ton of control. I just got off a webinar focused on entrepreneurs and freelancers, and we were talking about something like the CARES Act, where last week, we were looking at $10,000 grants, and this week we're looking at $1,000 per employee up to $10,000, and those are 2 really, really different things for a small organization. If you're an organization with 4 people, instead of like the opportunity to have $10,000, now you have at the very most 4, and those are 2 really different numbers. The second is disintermediation. And what that really means is we need leaders to get as close to the problem, as close to the ground as possible. Some of us can do this much more easily than others. If you're working in an organization that has 1,000 staff members, it's going to be really hard to get your senior VP to come out into the field with you. But in this moment of chaos, leaders need to be close to the problem so that they can start to see the solutions. Folks that are on the evaluation side of the house, one of the ways in which to get to disintermediation is by disaggregating data. We know that when we use disaggregated data, our solutions can be much more focused. For instance, earlier in this conversation, I shared that African Americans are suffering disproportionately. I mean, they're literally dying in much greater numbers. If we don't disaggregate based on race, we will never know this. So to the extent possible, you're probably out getting a lot of information quickly from the field, but start to disaggregate based on the categories that you've identified. The third thing is, and this is really hard for us to do as well because of the organizational structures and the hierarchies and the silos that we're in, is investing in your wild ducks and mavericks. The phrase wild ducks comes out of IBM's philosophies, and it's really focused on listening to the people that have the craziest ideas, the folks that are totally in the left field, that are going to bring you something that sounds a little cuckoo, when we're in chaos, those are the folks that are going to bring us the best solutions and the best innovations. And so it's an opportunity to get uncomfortable and put away our instincts, and start listening both to different parts of the organization, push information up, and down both, but also like listen to the people that have some like really insane ideas in your organization and make time for that. And the fourth thing is like really lean deeply into your organization's values in their best mode, or in their best form of being implemented. Most of us have organizations with incredible values like collaboration, connection. And so ask yourself, you know, like what does the best form of that value really look like in practice, and lean into it. I also tell a lot of my clients that, you know, when in doubt, like just bring your organization's values into the conversation, and ask the leadership, like, is this decision in spirit of the value that we have on the book? And it doesn't even require you adopting any new framework. You don't have to adopt another framework. You just have to bring in the things that you already have on paper and ask yourselves how to live into them, or whether the decisions that you're making are in spirit of those values. So those are, you know, this is our guidance. These are, you know, things that we're thinking about and working with our clients on. And yeah, we'll open up for questions in the last 15 minutes.
So, Carly, I don't know if there are any questions yet. I'm happy to also talk about this general overview of the recovery phase first, if questions are still coming in.
No questions so far. So go ahead with recovery phase.
Great.
And folks, if you've got any questions, throw them in chat or Q&A.
Yeah, so the recovery phase really requires, it's an amazing opportunity to build what you want, right? We often we often use this excuse of, you know, these systems are at play and we don't have a choice, and the people that sort of built these systems weren't thinking as equitably as they could or as inclusively as they could. Well, now we're at the table, and we actually all get to help rebuild and build anew what we want our reality to be, and really leaning into us as leaders and leaning into mindsets around equity and inclusiveness. I think are going to be absolutely critical to doing this justice. As a leader, it's really thinking about how do you lead above the line, constantly checking in with yourself, either you personally or with some accountability element, whether that's a coach, a peer, a colleague, whatever that might look like. Where am I currently? Am I leading above this line? Am I leading below the line right now? And if I'm below the line, how do I start to course correct? Either get enough time for myself to then come back with a new mindset, or to actually take some intentional action to switch and get myself back above that line. We're being asked to make rapid decisions on behalf of communities we are often not all that familiar with and don't represent ourselves. So holding a place for racial equity and privilege and vulnerability, that framework will help guide those decisions, and actually not just and partially reduce harm, but maybe even just create a better reality and a new status quo that it actually serves everybody. Aparna talked about switching from chaos, which is what a crisis is going to push us all into, back into complexity, and really starting to break problems into solvable chunks that allow you to still have that emergent strategy as things continue to become new, as you learn more information. How do you adapt to that quickly and keep moving, but within that framework of complexity? And then finally, as Aparna was just saying, really investing in that diversity. I love the concept of the wild ducks and the mavericks of, there's a very famous line, right? If we can't solve our problems by using the same thinking that created them in the first place. And if we want to build a different reality for ourselves and our communities and populations in the recovery phase, we actually have to think about it differently. So all of a sudden, those people that are coming out of left field, those wild ducks and those mavericks, are actually maybe asking some of the questions or pushing some of the ideas that old status quo us would have said, that's not possible. And in this new period where we're able to like really think about recovery and rebuilding, those wild ducks and mavericks might actually hold the key to thinking about our problem in a wildly new space. That's being open to those and actually seeking them out, maybe even incentivizing them in ways so that those ideas start to come to the forefront is going to really benefit you and your team and eventually the populations that you're serving. Again, all of this is shaped to try to give you the tools that you need to go do this yourself. There's too much work to be done. This work is too critical and too important. We want to make sure that you are all equipped to go do this at the highest possible level. That being said, we recognize that sometimes additional support is needed or wanted or appreciated. So from Third Plateau, we've got sort of three pieces here that we think are really relevant for this conversation. One of them is cohort coaching, which is pulling in executive directors and a cohort of executive directors to really learn from one another and experience and process and start to understand how they can, like what they're experiencing is not all that unique. But that space and that executive director chair or that CEO chair is often so lonely. And connecting with other people who are sitting in a similar chair and hearing how they're processing it and how they're thinking and doing that together is a really powerful tool. We also offer one-on-one executive coaching, so helping you tackle the specific issues that you're navigating and making sure that you're always equipped to lead above the line. And then finally, team coaching, not just working with you, but with the rest of your team. Maybe a senior leadership team, maybe your entire staff, whatever that looks like, to help all of you operate in this mindset of abundance and openness and what's possible. Aparna, do you want to talk a little bit about the, what you guys can do for operationalizing DEI?
Yeah, absolutely. I think before I do that, there's a question that's in the chat that says, how do you lead with equity if your leadership team is not diverse? What might we do now to create more diverse teams to be better prepared for future decision making? It's a great question, and I think it's a really hard one because there is so much value in lived experience and just coming from different places. And so, I think if your leadership team is not diverse, really going back to creating a very strong privilege vulnerability matrix is going to be important so that you keep your blind spots front and center as you're making decisions. It's going to be in inviting people that bring those perspectives regardless of where they are in the organization. And I will say that for social sector leaders, compensating folks that are bringing the lived experience that's going to help you make decisions. So to the extent possible, like that could be your field staff, having the opportunity and space to come into leadership meetings. It's going to look like in this moment of chaos, hiring consultants that represent the communities where you don't actually have experience of living and working in. It also looks like putting your hand up and saying, I don't know. And I think that there is so much value in just acknowledging what you don't know, and know that in this moment of a pandemic, there's a lot of grace to be given. One of the things that we're noticing in our clients, especially from the private sector, that I think is worth bringing into the social sector is using the employee resource groups or affinity groups in your organization to drive and feed into your executive or decision-making layer. And so lots of companies have, the Black Employees Network or the parents group or the women's, affinity organizations. And those are organizations that can help you get closer to the ground. And, of course, like I think that even a non-diverse leadership team, I'm just gonna like read into this question and say like your leadership team is mostly white. It's not a zero-sum game, like diversity and inclusion and equity, like these are all muscles that we can build all of the time, regardless of our identity. And so disintermediate, like go get closer to the ground. It's something that I tell my clients all the time. If I'm working with a leadership team and they want to reach new communities, I ask them to go spend a little time in that community. So if you're a media organization and you really want your clientele to be communities of color, spend time consuming media that they're consuming, spend time being part of like creative conversations that they're having. And that's the only way for you to know what's important for them. And it's also, a way for you to grow your inclusion muscle.
Aparna, can I add just a little bit? I agree with everything that Aparna just said. And I think the other element here that I think she's getting at the very end there that is I want to hammer home, which is always keep your end users front of mind. You are designing for them. You do not run an organization for the sake of running your organization because you like the way a program feels or you like running that program. You care about the outcomes you're producing. And everything you do is in service of those outcomes that you can produce. And so the more you can tap into who actually are your users and thinking really expansively and inclusively about who they are, and recognizing you don't know what they think and feel. You actually have to ask them. You have to go do research and figure it out, which is why we started this whole series with that rapid needs assessment. Don't assume you know what is best for other people. Figure out where their pain points are and where they see opportunity and design for that. And so even for a leadership team that maybe doesn't have a lot of diversity among it, you can still tap into like understanding, using the matrix that Aparna shared today and we shared earlier around vulnerability and privilege. Who are your different users from as many different angles as possible? And what is the pain point they're feeling? And design towards that. And that's at least an easy place to start as you then really start to build out those DEI muscles that Aparna is talking about. Aparna, I want you to circle back. What is it do you want to talk a little bit about what it means to operationalize DEI from Moving Beyond?
Yeah, absolutely. So when we started Moving Beyond, one of our goals was to help organizations see what doing DEI looked like outside of a training realm, which is not to say that training isn't important. It's to say that it needs to be part of our strategy. It needs to be part of our program planning. It needs to be part of our evaluation. It's a cross-cutting aspect of all of our work. And so we go into organizations that are, deeply desirous of ensuring that all the work they do happens with an equity lens, and specifically that the work they do is really like coming back to like being in service of impact. Organizations that are really interested in moving beyond an outputs mentality into an outcomes mentality. And so at the core of it, the work that we do is still strategy and evaluation and coaching, but it's helping ensure that the next time you're doing a strategy refresh, like equity is front and center.
Okay, thanks, Aparna. And then before we open up for other questions, I just want to remind people, tons and tons and tons of resources here. Please also check out the Moving Beyond website, but come here, all of the recordings of this webinar, all of the other webinars, all of our slides, the handouts, the frameworks, and a whole lot of other information is all on the website for you. Please, please, please do use it. We're trying to be as helpful as possible. So know that a whole lot of other information is there. Carly, are there any other questions before we turn to wrap up?
No other questions have come in so far. But folks, if you've got any, feel free to throw them in very quickly, or I'll hand it off to Jonathan to wrap up.
So I'll start to wrap up. And if there's a question that pops up, happy to, Carly, just interrupt. So we've spent this entire series talking about how to navigate something like COVID-19 and really trying to bring these best practices of disaster management from our experience at Third Plateau, from the experience at Moving Beyond, of like, what does this actually look like in a situation that most of us were ill-equipped for, right? Most of the nonprofits and foundations in the country are not used to this type of thing, certainly not used to something that is unfolding for as long as this is unfolding for. Very different than, maybe a hurricane or a fire or a tornado that are awful, but often the event itself is relatively, the timeline of it is very, very specific and relatively short compared to a crisis that is unfolding and continues to unfold for months and months and months and months. So trying to bring those best practices here so that you're not shooting from the hip or guessing in the dark on any of these pieces. As you get to the recovery phase and really thinking about what's possible moving forward, it's never too early to start thinking about this. Most of our brain power right now needs to be focused on the response phase and the mitigation and preparedness phases for what's still to come in the coming weeks and months. I recognize that. The sooner you can start to turn some attention to the recovery phase and what you want the world to look like afterwards, the better equipped you're going to be to actually make that possible. Seize that opportunity and lean into it. What do you want the world to look like? And how do you help make that a reality? And if you lean into your leadership and how you are equipped as a leader to lead above that line and help others lead above that line, and you lean into the role that diversity, equity, and inclusion should play in your redesign of what you want that world to look like, I'm really excited about where we're all headed as a social sector and where your individual organizations are all headed. I know your funders will be excited about it, your volunteers and staff will be excited about it, and most importantly, the populations you serve will actually be better suited and better supported. With that, I just want to say thank you to everybody for joining us. Carly, was there one last question that snuck in there at the deadline?
There is one,
right,
and I think it's actually a really good one to wrap on. Someone would like to know, what's the best way to ask questions? Should they think of them next week or as we're moving forward?
Now.
Great question. So I'm going to ask them now by all means, but I'll put up my email address is there at the bottom. Please, you can also just go to thirdplateau.com or movingbeyond.co and feel free to reach out to either of our organizations that way. But please, do not be shy. Ask the questions that you've got, and know that we're here to help. We always want to be of service, especially in a critical time like this. Don't hesitate to reach out if there's ever anything either of our organizations can do to help. But really excited for where all of this can go. And please, good luck with all of it. Stay healthy and safe. And keep us in the loop as you guys are making major decisions and navigating all of these frameworks. Thank you all.
Thanks, everybody.
Thanks, folks. Have a good day. Bye.